دكتور عبد الهادي, we are live.
Assalamu alaikum wa rahmatullah. Good evening, everybody. I just want to give you a slight note that we're going to start, inshallah, in 5 minutes to allow for people to join this session. Then we will do the introduction. What I want to give as a note, that because of the prayer time, we will start at 10 past 6. Dr. Ali will start his lecture, and after half an hour we will stop to allow, according to Riyadh timing, so they can catch Maghrib prayer, and for Western province it will be suitable for us, inshallah, also to catch the prayer. So after that, say from 10 past 6 until 40 past 6, we will then resume after 15 minutes. So like, for example, 5 to 7, maybe another half an hour to complete the lectures. Then there will be some times for the question. So we allow for another 5 minutes. Then we will do the introduction and we'll start the lecture, inshallah. We may start, inshallah. As I said, Bismillah wa salatu salam ala Rasulillah. Good evening, everybody, and welcome to this webinar. I'm honored to be a moderator. I'm Dr. Abdul Hadi Bima, moderating this session, which is organized by the Saudi Society of Clinical Chemistry. Thanks for the Saudi Society for Clinical Chemistry for organizing and also hosting this important session. this session, inshallah, will start now. Again, I just want to give a brief note about prayer time because we are living in a different area. So Dr. Ali, inshallah, will start for 30 minutes from now. So at 6:40, we will stop for prayer time. So people who's in Riyadh and surrounding area, they can catch Maghrib prayer, inshallah. And for us in Jeddah, inshallah, we'll be able also to pray. We'll give that prayer 10 to 15 minutes max. So we'll come back again at 6:55 max. Then probably it will be another half an hour. And if you have any questions, and we will be happy to receive all your question in the question and answer section just next to the chat icon. Today, I would like to welcome Dr. Ali Mihrizi, who's a close friend of mine, and I'm honored to be a colleague with him in different even countries. We've been in Australia together. Dr. Ali Al-Mihrizi received his clinical laboratory science test from College of Applied Medical Science at King Saud University in Riyadh. Then he completed his master degree with laboratory medicine, master on laboratory medicine at RMIT University in 2010, followed by a PhD in laboratory and clinical science at Faculty of Health and Biomedical Science at RMIT University in Australia, and he get his qualifications in 2018. Since then, Dr. Mihrizi has worked as a medical technologist and a senior medical technologist in King Fahd Medical City, and he's currently an associate professor of laboratory medicine at Al-Baha University. He published numerous scientific papers in non-alcoholic fatty liver disease, and it is actually his area of interest. He conducted many research as a molecular biology related to the metabolic syndrome and liver disorders. Today, Dr. Ali will give us a lecture about the chronic diseases, a scientific lecture in alignment with the World Health Day in 2026. We are looking forward for a very interesting and a very important topic which cover an area that is touch every single body. So the awareness about these chronic diseases and build the awareness among the society is a very important. And this is one of his individual effort and an effort from the Saudi Society of Clinical Chemistry to spread this knowledge. We are looking forward for an excellent, inshallah, presentation from Dr. Ali. Dr. Ali, the mic is yours.
السلام عليكم ورحمة الله وبركاته. الصوت واضح دكتور عبد الهادي؟
أي نعم واضح. حياك الله يا مرحبا.
It's been a long time دكتور عبد الهادي. بسم الله والصلاة والسلام على رسول الله. أما بعد the first thing I would like to thank Dr. Abdul Hadi for his nice introduction. It's been a long time not seeing together and not meeting each other, but thanks God we had this online and virtual meeting. That's good, and I would like to thank Saudi Society of Clinical Chemistry providing or giving us this opportunity to talk to you, and special thanks to Dr. Anwar Bura'i and Mrs. Maha and Ustad Ali for his support and help in this presentation. In the beginning, everyone knows about chronic disease, and it has been very prevalent in our community. I will start my lecture with a quote by Louis Pasteur. He's a chemical and microbiologist. He's chemistry and microbiologist scientist. His quote is, "Science knows no country because knowledge belongs to humanity." This quote is mean science, there is no border, no culture, no group, there is no limit for science. So the human who bring this information will share this information, will share this knowledge with other people. And For today is 7th of April, and each year in 7th of April we have a special day. This day is called World Health Day. World Health Day, and previous 10 years, as you can see in this slide, is all the World Health Day theme is interesting or focusing on health and the prevention of diseases and about the awareness of community. As you can see, in 2017 is Depression Let's Talk. The next year is Universal Health Coverage, everyone and everywhere. In 2019, Universal Health Coverage, everyone, everywhere. Focus continued. In 2020, Support Nurses and Midwives. In 21, Building a Better, Healthier World. In 22, Our Planet, Our Health. And 2023, Health for All. 2024, My Health is My Right. And in 2025, Healthy Beginnings, Hopeful Future. And most of these themes is focuses in health, prevention, and awareness of the disease. For this year, and I am fortunate about this year because I had this lecture to do it with the SSCC for this special day. And the theme for World Health Day theme for 2026, Together for Health, Stand with Science. I think most of you has been searched for the theme, and this theme is has two phrases. The first phrase is called Together for Health. That's mean it's highlighted the collaboration between governments, health workers, scientists, researchers, communities, and individuals. Each one has to coming to each other and together for health. The second phrase is called Stand with Science. Stand with Science. This is emphasis or focus in trusting scientific research and experts and relying on evidence-based medicine and prevent misinformation and myths, which is about health. And we can hear and we can see a lot of misinformation about health is spread quickly in the world, especially after COVID-19. We had a lot of example. The second viruses is coming, and this a lot of misinformation. So stand with science means we have to be trusting scientific research and expert. And the second slide. Okay. For the most important topic for today, it's chronic disease. And I have heard about, when I ask any person in this chat, is anyone has chronic disease in your house? He will say yes, because chronic disease, it's been infected each house in the community, globally and nationally. The chronic disease has two definitions. This is the most common definition I have searched about it. Chronic disease is defined broadly as condition that lasts 1 year or more and require ongoing medical attention or limit activities of daily living or both. So when you have disease more than 1 year, and some of definition is been 3 months to 6 months, but the latest one is by CDC has been said last 1 year or more, require medical attention. Okay. The second definition is long-term illness, which impact multiple parts of your body and which is not entirely responsive to medical treatment. When there is a patient with a disease and it has been affect his organ like heart or like a lung or kidney, And the treatment, there is no benefit for the treatment, or there is no effective treatment for this disease. This is called chronic disease. Most of the chronic disease, or we can say 4 major chronic disease: certain cancer, cardiovascular disease, diabetes, and chronic respiratory disease. Certain cancer, some cancer is chronic, and it can be managed. Cardiovascular disease also, it is chronic and can be managed, like ischemic heart disease. Diabetes also, and chronic respiratory disease such as COPD and asthma. This example for chronic respiratory disease, asthma and COPD. And I think this slide is not clear, but I will try to read it to you as much as I can. This is some characteristics of chronic disease, which is usually caused by risk factor that is related to behavioral, environmental, and genetics. And it's been the second features for chronic disease: persist for long period, and can recur throughout life. Yani can repeat this disease in your life. The third one is some of these diseases can be prevented, some cannot. Okay. Many of these diseases has no cure but can be managed. And the last one, disease is not infectious. It can not be transmitted to another person, and it's not contagious. Okay, it's not contagious. That's the features of the most of the chronic disease. So it's persist for a long time, and it risk factor can be environmental and genetics and behavioral, and can prevented, or some disease can prevented, can be managed. Why chronic disease is matter? Why it's important? Why everyone has to know about chronic diseases? Chronic diseases, as I said before, it's invade every house in this world, in this globe. Okay, it is leading cause of death, disability, and high health costs worldwide. As you can see, annually death around 41 to 43 million people, which is means 75% of all death. 75% of all death. So if the percentage or number of people die each year is around 60 to 65 million. 60 to 65 million per year. And chronic disease, 40 to 43 million people die from chronic disease, which is very high number and very significant number. We have to take care about this prevalence and this number. Just in USA, 3 out of 4 American at least has one chronic condition. Okay, 3 out of 4 American adults have at least one chronic condition. And we will see the next slide about people who has, or patient has more than one chronic condition, is called I will go through it in this slide, inshallah, next slide. So in Saudi Arabia, roughly we spend around 90 billion riyal, which is mean that chronic disease is really costly and it affects a lot of people. So this is why it's important to know the chronic disease, which is existing, the cost 90 billion riyal, which is around $24 billion. And in USA, roughly 2 trillion annually in medical cost. 2 trillion annually in medical cost, which is very huge and costly amount of money. So as you can see in this slide, the leading cause of death, this is from CDC in 2000 or 2021, and death per 100 population. In male and female, and you can see there is no difference between male and female, except in COVID-19, it's in the third rank in male. However, most of the diseases is related to chronic disease. As you can see, in first one is ischemic heart disease, which is chronic disease. So it is the leading cause of death. And the second one, if you can skip road injury and COVID-19, hypertension or hypertensive heart disease, which is chronic disease, kidney diseases, diabetes mellitus, cirrhosis, stroke, all this, and lower respiratory infection, all this disease is related to chronic disease. And that's why to know about the chronic disease is important, and how to give information about chronic disease is important to the community. This is some statistics, which is just to show you the importance of chronic disease and how it's affecting global and especially in our country, in Saudi Arabia. It's around 20,000 Saudi die every year from 4 main non-communicable disease. As I said before, non-communicable disease, 4 main non-communicable disease: diabetes, cardiovascular disease, cancer, and respiratory diseases. This is 4 main non-communicable disease. And 35% of all death in the US, in the Kingdom of Saudi Arabia, is related to chronic disease. This is very high percentage. And if you can see in the lower one, is about the 28%. Is saying that 28% of these chronic disease, or of these people die from this chronic disease, is related to cardiovascular disease. If you can see in the top of the obesity rate among adults in Saudi Arabia, it's roughly 23 to 35, and this one of the risk factors related to chronic disease, which is it's been clear for everyone. It's obesity increasing around the world, and in KSA, or in Saudi Arabia, more than 1 in 4 people are currently affected by one of the 4 main non-communicable diseases. So 1 in 4, it's high percentage. That's in 4 people, there is 1 is affected by chronic disease. Okay, and diabetes and obesity are the most relevant metabolic risk factor in the Saudi Arabia. And the prevalence in the down and the below this figure, prevalence of hypertension around 27% among adult. The second slide, which is important about, we know about the definition now about the chronic disease and the type of chronic disease and why it's important. And we give you some statistics to show you the importance of chronic disease. How we know the cause of chronic disease? Chronic disease come from where? It's come from mostly from 5 causes, or from 5 risk factors. The first one, excessive alcohol. and consumption. The second one is family history, which is related to genetics and environmental factors. Lack of exercise, physical inactivity. People, they are not doing exercise, they are not walking, they are not running. Poor nutrition, and we will explain this risk factor or the cause of chronic disease in the next slides. Poor nutrition, usage of tobacco, or we can say smoking factor. In Saudi Arabia, we do aware about of this issue. And MOH and our Saudi Vision 2030, it's giving us ideas about how to know about chronic disease and how to prevent. It's just awareness for community. And there is a program called Saudi Health Transformation. It's been implemented in MOH, which is concerned with overall public health and aimed to facilitate access to health services and enhance their quality, focusing on prevention before treatment. And one of the aims of Saudi Vision 2030 is focusing on strengthening prevention and digital health. MOH has been implemented a lot of programs. One of these programs is wellness program, which is aimed to increase physical activity and improving dietary habits to reduce obesity. And Saudi Society of Clinical Chemistry has been given some awareness through the lecture and through the messages, through the emails, to update with the latest development with regard to clinical aspect of clinical chemistry and laboratory medicine related to chronic disease. Also, Saudi context has been showed that obesity and diabetes is highly prevalent or highly affect many people in community, increase in diabetes, obesity, and heart disease. This linked to modern lifestyle changes and many causes related to increase of these risk factors, diabetes and obesity. One of these key factors is unhealthy diet, fast food, sugar drink, processed meals, and a lot of food that is unhealthy and not benefit for our body. Physical inactivity, less movement, or more sedentary habits. There is no exercise, no energy expenditure through the body. Urbanization, when the people move to the city or a more urban area, is convenience, reduce physical effort, and you can see nowadays a lot of application for ordering even food, clothes, anything in this life you want. We just order through the application, and in 5 minutes or more, it will be in your reach to your house. And thanks God, this is a good thing, but it's affecting us in physical effort, which is people cannot walk and go through some activities. Increased screen time, more time on device such as laptop and mobile, which is lead to less activity. And this is, of course, it will health impact our society and with higher obesity rate and increased chronic disease. As I said before in the previous slide about the multi-morbidity, this is when patient has one or more, more than one in chronic condition. So multi-morbidity is called or is identified as living with two or more chronic condition, and has become as an increasingly important public health concern due to its impact on health care system and patient quality of life. And from this paper, which is published in 2025, recent publication, it's said that the prevalence of multi-morbidity in Saudi Arabia is around 23. So patient in Saudi Arabia with chronic diseases, he will have more than two or more chronic condition. Risk factors of affecting or risk factor for chronic disease, as I mentioned before, it's about tobacco, physical inactivity, unhealthy diet, harmful use of alcohol. But for these things, for this risk factor, most of the risk factor affecting or can cause most of the disease except tobacco, which is related to respiratory, as you can see in this figure, and in this figure. Tobacco use is affecting cardiovascular or can cause cardiovascular disease, can cause cancer, diabetes, chronic respiratory disease. Physical inactivity and healthy diet, harmful use of alcohol cannot cause respiratory disease, but can cause diabetes, cancer, and cardiovascular disease. I will go through the most common chronic disease, and I will go through cardiovascular disease, and we will stop for the prayer, and then I will continue after the cardiovascular disease, inshallah. So the cardiovascular disease is the leading cause of death in Saudi Arabia. It's account for approximately 35 to 40% of all death. One of the most common disease, coronary artery disease. It's around 1 in 3 adult has hypertension, and 25 to 30% adult are obese from this cardiovascular patient, and nearly 18 diabetic. So it's this is indicating that diabetes and obesity are the most common risk factor for cardiovascular disease, as the percentage or the percentage of obese patient in cardiovascular disease, it's exceeding the 25%. However, in diabetes, is more than 18%. How to diagnose cardiovascular disease in laboratory, as we talk about in clinical chemistry or chemistry lab. We test lipid profile, and most of the biomarkers for cardiovascular disease, troponin, and ECG is electrocardiogram and echocardiogram. For chronic or cardiovascular disease biomarker, as I said, elevated troponin, and in we can differentiate between cardiovascular disease and heart failure by testing B-type nitrotic peptide. This is a protein used to test heart failure, or to differentiate between heart failure and myocardial or cardiovascular disease. You can see low HDL and high LDL, which is causing atherosclerosis risk. And I will stop in this slide in hypertension, and we can go for prayer, as Dr. Abdul Hadi said in the beginning of this lecture, and we'll go back after 10 minutes, inshallah. Thank you, Dr. Abdul Hadi. Okay, inshallah, we'll start. May Allah bless you guys and may Allah accept your good deeds, your prayer and your dua, inshallah. So, as I stopped before, we talk about the chronic disease and we talk about the cardiovascular disease. And now we talk about hypertension. Hypertension is prevalence is about 25 to 30 in adults in Saudi Arabia, and many cases remain undiagnosed or uncontrolled, and especially for the older age, they didn't diagnose for hypertension or they don't know about hypertension in their blood. Awareness and control, only about 50 to 60% of people are aware of their condition. A smaller proportion achieve adequate blood pressure control. How to diagnose? What is the cause of the causes of hypertension? High salt intake, increased water retention, and raises blood volume and pressure. As we increase water retention, that means the sodium will reabsorb again to our body. Obesity, which is another causes of hypertension, which is increased heart workload and vessels resistance. Stress release hormone that narrow blood vessels and raise heart rate. And you can see in this figures about some of extra of hypertension causes, such as genetics disorder related to hypertension and smoking, excessive alcohol and regular exercise or inactivity of exercise. How to diagnose hypertension? Through blood pressure, which is systolic and diastolic, and through serum creatinine, which is the end product of creatine in the muscles. So creatinine, because hypertension is affect kidney vessels, and which is can cause kidney disease. And creatinine and urea, it's the markers for kidney disease. Electrolyte, because of sodium and potassium and other electrolyte, will disturb and impairment in the hypertension. Lipid profile also will affected through the hypertension. When normal 100 less than 120 in systolic and diastolic is 80. This is normal blood pressure. It's around 80 and 120. Or we call 120 over 80, which is normal blood pressure. When there is a little bit elevation of blood pressure, 120 to 129 over the 80, but when it is 180 more, 140 over 90, that means the patient is hypertension and is going to prognosis and hypertensive crisis of hypertension. So check regularly. It's important for hypertension people and even for normal people to check their hypertension at least 3 times a year. Diabetes. Diabetes is one of the chronic disease, and diabetes is high blood related to dietary or diabetes in Saudi Arabia in 2024. Total adult population is around 24 million in 24, but now we had more adult population. Prevalence of diabetes in adult is 23%, more than 23%. Total cases of diabetes in adult is around 5 million or more than 5 million people who has diabetes. Diabetes diagnosis. Diabetes lab test is fasting blood glucose, which is the normal or random blood glucose, and then fasting blood glucose HbA1c, oral glucose tolerance test, or OGTT. Diabetes monitoring through the HbA1c less than 7%, which is should be good control, and monitor quarterly as the RBC's lifespan is 120 days, which is around 3 months. So it's good for patient with diabetes to monitor quarterly. Screen for complication, which is diabetic retinopathy, neuropathy, and nephropathy. These are three most common complication or micro complication for diabetes. How to diagnose diabetes? In this table you can see, or the figures in your right, HbA1c more than 6.5%, that's mean patient is diabetic. Fasting blood glucose, when the patient fasting blood glucose is more than 126 milligram per deciliter, which is equal more than 7 millimole per liter, and the patient is fasting more than 8 hours, it's indication for diabetic. When 2 hours postprandial glucose more than 200 milligram per deciliter, which is more than 11 millimole per liter, that's mean indication of diabetes. Random blood glucose more than 200 milligram per deciliter, you can do the test anytime. This is also diabetes indication. If there is too abnormal of these 4 tests, it's clear of hyperglycemia. And patient has to refer to diabetic center. One of the most common chronic diseases related to respiratory system is asthma, and chronic asthma is chronic inflammatory airway disease, respiratory system, or symptoms such as wheezes, cough, chest tightness, shortness of breath. And also it's expiratory airflow limitation. Patient cannot expire or release air sufficiently, and airway hyperresponsiveness, bronchoinflammation, and reversible bronchoconstriction. This is some of the symptoms of asthma patient. Approximately 2 million people, which is around 6% of the population, with reference rate, and in children is around 8% to 25%, depending on the region. And as I read before about Al Jouf and Medina Al Munawwara, high children with asthma in these 2 regions. And Center of Diabetic and Prevention, CDC, they use exhale strategy, which is E from education, X from extinguishing, H from home, and A from achievement, L linkage, and E environmental. And this strategy to prevent patient from, or prevent individual from asthma. How to do lab test for asthma? It's spirometry, which is in this picture. Patient breathe or exhale the air in this machine, and it will measure the BEF and FEV, which is forced expiratory volume, or how patient can give air per breath. Allergy testing, one of these lab tests, and maybe chest for X-ray. Kidney disease, one of the chronic disease, but we said kidney disease because it's linked to hypertension and is linked to diabetes, which is kidney has glomerular and tubules, as you can know before. Glomerular disease such as acute glomerulonephritis and chronic glomerulonephritis, nephrotic syndrome. In tubular, there is proximal distal tubular renal acidosis, renal obstruction, renal calculi stones, and renal failure and renal hypertension. This is the most important of kidney disease, but not all of them we can say it's chronic disease, but like chronic glomerulonephritis and nephrotic syndrome, this is take long time and lasting in the patient for a long time, more than 1 year, and sometimes obstruction, stones, renal calculi, which is persist in the patient for a long time, which is can be under chronic disease. How to diagnose kidney? Of course, we said the biomarkers for kidney in lab is serum creatinine and serum urea. Serum creatinine and serum urea. From these two tests, you can test or you can calculate creatinine clearance and EGFR. EGFR, estimated glomerular filtration rate, and it should, if it's less than 60 ml per minute, that means patient is has a kidney issue. Sorry. Both serum creatinine and creatinine clearance are used as kidney function test to confirm the diagnosis of renal disease or to give an idea about the severity of the disease, or to follow up any treatment for this patient. Also in mental health, which is referred to mental health condition that are long-lasting, which is often persistent for month or year and require ongoing management, similar to other chronic medical illness. So depression, anxiety, and stress can be chronic diseases. I think from this paper, which has been published in 2025, they said the prevalence of depression in Saudi Arabia is exceeding that 12%, and which is indication of this disease. It will be a chronic disease in the coming years. However, there is a lot of programs and campaign to prevent the disease before occur. Okay, we completed the most chronic disease. We talk about the cardiovascular disease, we talk about diabetes, and we talk about hypertension and mental disease. Now we go through what is the risk factor for chronic disease. What is the risk factor for chronic disease? We said obesity. Obesity, it's the most common risk factor for chronic disease. When the BMI is exceeding the 30, that means the patient is obese, and it should manage this patient persistent. 32% adult, strongest risk factor for chronic disease. Obesity can caused or can poor nutrition and physical inactivity are significant risk factor for obesity and type 2 diabetes. The other risk factor for chronic disease, physical inactivity. Physical inactivity. according to WHO, over 1 in 4 adults worldwide are insufficiently active. That's mean 1 in 4. That's mean 1 in 4 will affected or will affected by chronic disease. Sedentary lifestyle, when there is decrease of physical inactivity, this will lead to decrease energy expenditure, and this is will lead to weight gain and obesity. When there is less activity, less exercise, this will lead to decrease of insulin insensitivity, and this will lead to type 2 diabetes. When there is a low exercise activity, will lead to low cardiac fitness, and this will cause hypertension and heart disease. When there is muscle activity or decrease in muscle activity, this will lead to poor lipid metabolism and increased inflammation, which can lead to cancer and chronic pain. Diet, this is, I think, is Dr. Abdelhadi Bima interest about diet, which is, this is related to high intake of sugary food, drink, soft drink, excessive fast food and fried food. Diet also high in saturated and trans fatty acid. High salt diet, low intake of fruits and vegetable. This will lead to, this is one of the risk factor that will lead to affected by heart or by chronic disease. And most common one is tobacco. It's so in Saudi Arabia in 2025 faces a significant smoking burden with over 4 million smokers and rising prevalence, especially among women. However, in 2025 also marked a major milestone with hundreds of thousands quitting from and reflecting strong public health momentum and alignment with Vision 2030. As in this column figures, you can see the increase of tobacco use or number of current smokers in Saudi Arabia. In 2024 is more than 4 million smokers. 4 million smokers. And hopefully by 2025, 2026 data, we will see decrease in smokers. Environmental factors. This is another risk factor for chronic disease. One of the environmental factors is air pollution. Air pollution, which can cause heart disease, stroke, lung cancer, and diabetes. Heat exposure, cardiovascular strain, and kidney disease. Urban environmental stressors, inactivity or obesity, respiratory diseases. Industrial emission, can cause respiratory and cardiovascular condition. Another risk factor, which is genetics, and one of the most cause genetic related family, it's high consanguinity, which is اللي هو زواج الأقارب أو الأرحام, which is in Saudi Arabia we can see 50 to 60% of this issue related to genetics and other familial clustering of diabetes, hypertension, and heart failure or heart disease. High prevalence of inherited lipid disorder and genetic susceptibility to chronic kidney disease. And this information has been taken from this research, has been published in a recent one in 2026 in BMC Public Health Journal, and the title is Burden of Chronic Disease and Associated Risk Factor Among Adults in Saudi Arabia, result from National Telephone Survey, which is this is easy, can done by application and answer through the phone. So acute model of care, which is sick people come to hospital. This is in acute state. In acute state, we talk about chronic diseases, but this acute state, sick people come to the hospital, provide treatment, and discharge. However, in chronic disease are not curable. A quick fix is a different approach is needed. So in chronic disease, no quick fix, because chronic disease is long-lasting term and need more prevention, need more awareness, need more treatment, need more management. So what we can do, refocus from acute episodic care. Prevention is better than treatment. Early detection, early diagnosed, early test or diagnosed, go through the lab to the hospital, to your doctor, ask for some of the lab tests early before the disease. Management and planned and evidence-based, reducing the burden of the disease. This will occur by addressing the cause of illness. Public Health Authority, وقاية. This is one of this program and one of the implemented commission national prevention role. One of the aim of وقاية is improving health and disease prevention, artificial intelligence in the field of public health, health security, laboratory sciences, workforce planning, improving education, providing public health laboratory services and accreditations, publishing scientific report, and developing strategies and planning. Opposite to what we have said in the previous slide about the chronic disease, which is high prevalence in Saudi Arabia, and it has a lot of complication, comorbidity, and this stuff. There is a lot of promising in chronic disease through the vision of 2030 health transformation, which is focused on prevention and access. The second promising things is awareness campaign promoting health lifestyle, digital health, which is help a lot of patients through صحتي application, telemedicine, and early detection and screening program, improved health care services, and positive lifestyle shift. Take-home messages from this lecture. Chronic diseases are preventable, okay, and not inevitable. Early detection saves lives and reduces long-term cost. Lifestyle is medicine. Daily habits shape long-term health. Technology and data are transforming prevention and management. Everyone has a role: health provider, individual, families, communities, and system. Saudi Arabia is advancing through prevention, innovation, and awareness. Each one for global health, from local health and international health, we all looking for safe and clean world without any chronic disease. And we end my presentation with this quote by Nelson Mandela. He said, "Education is the most powerful weapon which you can use to change the world." And most of my presentation has been taken from Saudi NIH, from Ministry of Health, وقاية, World Health Organization, الهيئة العامة للإحصاء, General Authority for Statistics, and CDC, which is Disease Control and Prevention. And thank you so much for listening, and I'm happy to answer any questions.
MashaAllah, tabarakallah. Many thanks, Dr. Ali, for this very excellent and comprehensive presentation about the chronic disease. So now we are receiving question and answer. So please, if you have any question, just post it in the question and answer section. We already have a couple of questions. So this is a question from Isra, saying that like he noticed, or his comment, like diabetes have more complications and early complications, such as even GIT problem like hemorrhoids. And is there any input in regard of any medication to just maybe affect the cell signals to prevent such complications? And also from Isra, so why diabetes having more complications that comparing to other chronic disease? And the other question, is there any medications can prevent these complications of which is coming from maybe cell signaling pathway disturbance? And the other question is, most of this chronic diseases is detected like really very late. So is there any suggestion of how we can detect them earlier? This is the first question.
It is a long question, Dr. Hadi, but I will start point by point. When the patient, when the Oiden said diabetes, it has a lot of complication through GIT and other hemorrhage. Yes, but we're looking for when we diagnose it, we diagnose the micro complication, which is as I mentioned in the slides, retinopathy, nephropathy, and neuropathy. And of course, there is a lot of research going on about the hemorrhage and related to diabetes. When there is a diabetic patient, especially in the severe stage, of course, he will get a lot of GIT problem. But I'm not sure about the pathways of diabetes related to or affecting the hemorrhage or GIT. And I think there is one question.
Is there any way to detect it earlier? Because his comment is like we are discovering these chronic diseases when it already have complications.
Yes.
Is there a way to detect it earlier?
Yes. As you know, actually, detection earlier is more important than treatment. And the government and globally, they are looking for some of the standardization for early detection for some diseases, especially chronic diseases. Like I said before, in hypertension, 60% they are not diagnosed. They have hypertension, and this is big issue. And early detection, it's starting from the individual. He has to go to the clinic, go to any lab center, just give some blood and measure your blood pressure. And this is a way prevention area than affecting by these diseases. And another way to early detection, which is awareness for the individuals, and make a lot of campaign, حملات يعني توعوية to give an idea about this chronic disease, such as of this lecture. And I hope a lot of community they attend this lecture. But sorry, it's in English, but we'll try speaking Arabic anyway. So a lot of campaign, a lot of advertisement, not advertisement, but a lot of guidance and a lot of prevention way before the disease coming through the patient.
Okay, may I just add a comment? So thanks, Isra, for this question. I also agree with Dr. Ali that if you have a family, now you are glad that we have at least more than 200 attendants. So spreading the knowledge of if you have a family history, so you might need to go and seek medical advice earlier, like when you're approaching a middle age, like maybe even 35 or 40 years of old, go and check your lipid and glycemic markers and all these things. And also check for the hypertension, and the more factors you have, such as family or obesity, you probably need to just really go and check yourself. But I want to add also, since this is like a session for Saudi Society of Clinical Chemistry, so I hope that there is a lot of laboratorian here and medical doctors. I was raising the flag of when we have, I think that massive failure that we are having now at the moment, as you mentioned in your presentation, 1 in 4 person, that 5% of our population suffering of these chronic diseases. In Lancet, and I was so glad you show obesity as a risk factor. I just want to mention, maybe when we go from talking about obesity as a risk factor toward as a clinical condition, so we will tackle it more aggressively, because this is actually not my opinion. In 2013, the American Medical Association considered it as one of the chronic diseases. WHO, they consider, since 1990s, they consider obesity as epidemic, global epidemic. So it is a disease. So when we switch our thinking from obesity, for example, which is related to what I'm coming for as a laboratorian and a role that we can help to prevent, when we consider it as a clinical condition, not a risk factor, so we will look more carefully and we might push the patients to correct that condition instead of considering as a risk factor. So as a laboratorian, in my opinion, so I hope that there is a lot of laboratorian here, we might supposed to talk with our physician to think about markers that actually detect the deviation from normal toward pathogenesis earlier than dysglycemia. When I say dysglycemia, it's even a hyperglycemia that is not yet in diabetic range, in pre-diabetes range, for example. That deviation from normal to the pre-diabetes level is actually happening 10 years after the increment of insulin or hyperinsulinemia or insulin resistance, which is insulin resistance is the root for all or almost most of the chronic disease that we are talking about nowadays. So hypertension, obesity, diabetes, all these, the root of insulin resistance. So if we really want to do prevention, I agree totally with you, Isra, that we're supposed to detect it earlier. So if we want to detect it earlier, we're supposed to use a more sensitive marker such as insulin, not a marker like a dysglycemia, which detect the pathogenesis 10 years, a decade after the deviation from normality. Here we can also really do a great favor for the community to detect and prevent. And when sometimes I advocate for this, sorry for the long comment, but I think it's excellent webinar, excellent presentation. It's time to increase the awareness. So people, they said, well, insulin is not everywhere in every lab. It's expensive. I always say, we don't want to be, as a medical practitioner, to be passive with industry. We're supposed to push the industry toward what help the patients. So if everybody is requesting insulin, we will put more demand on this test. All the companies will start to produce more and compete, and they will bring that insulin to a very, very low price, such as maybe glucose, for example, or even a little bit higher. So I think we can have an active role to early detection, and I think everybody have his part to push not only the individual and awareness of individual, we have as an industry and medical service provider push to that, to look for markers that have an early detections. Okay, I will go for the next question from Asma. She said, is it coincidence that chronic disease here are non-infectious disease? So what is your comment? Is it a coincidence that is non-infectious disease?
Actually, the chronic disease shouldn't be infectious.
Yes.
Okay, this is the most important. Chronic disease shouldn't be infectious. It's non-contagious and is not transmitted through person to person or from animal to animal. This is my comment about this question. If you had any comment about it, maybe you can help me, Dr. Abdelhadi.
I agree totally with you. It's just like whenever the problem, I think we are as a medical service provider, we've been so happy with treating people with pills because communicable disease was the overwhelming problem in previous centuries. And we've been happy to having antibiotics as a pill, so that pill, it will cure that bacteria. But when we come, as you say, to a complex diseases like this chronic disease, a comprehensive approach of lifestyle, as you highlight, is more important, and there is no such medication will solve it. So I agree with you with the excellent inputs about exercise, about diet, and all these other. There is no such pills will help. I can just comment, maybe I can guarantee you will not find any individual treated only with medication without the involvement of lifestyle. They will have a better progression in their disease, especially type 2 diabetes, for example. None, I never see, I can put a bit of 1,000 real if you bring me a patient without doing any lifestyle modification at all. He is like a couch potato, no exercise, no modification of food. With all these medications that we pump our patient, they will reverse their diabetes. But I can guarantee you that there is so many others without even medication. If they improve their lifestyle, they get rid of the medications, which is the vice versa. That's mean the factor of lifestyle, the things that you are highlighting here in this presentation, is more important than medication. I'm not disregarding the medication, especially in acute cases, but this is a chronic problem. So emphasizing the lifestyle is actually the real player, and the medication maybe is a helper, not the vice versa. So we used to talk with the communicable disease with antibiotics. The diabetes is not going to be treated with pills.
Yes, true.
Okay, one more question from Ali. He is like a student of yours, and it looks like he have a lot of admire love for you as a teacher with his comment. And he said, is good nutrition, which is something we've been talking about, and adequate sleep with sport activity enough to prevent chronic disease? And what do you recommend for preventions?
Prevention for what? Sorry?
His question is good nutrition and adequate sleep with the sport activity enough to prevent chronic diseases? And what do you recommend for prevention?
Yes, as you said, Dr. Abdelhadi, which is when the patient or individual has this chronic disease, he has to take the medication. He has to go to a hospital. He has to take these pills. But as you said, good exercise, good nutrition, good environmental health related to your place, environmental health, it doesn't prevent you from chronic diseases. Some chronic disease is related to genetics, so which is you cannot avoid it. Even you had a good exercise or you have a good well-being, but you cannot avoid it because it's related to genetics. Some of related to air pollution. You are a good, healthier man, but you are living near to the factory, which is a lot of air population. That will lead to respiratory disease or lead you to asthma. And one of the genetics diseases, type 1 diabetes, which is you cannot avoid it if you are, because it's coming from you when you are a baby. So it's good prevention way to do exercise, eat healthy food, but it's not preventing you from chronic disease. إلا ما شاء الله أن الله يعني help you until you reach your 100 years, inshallah. I don't know, but this is what my suggestion about this question.
If you allow me, I just comment also on this. There is first, like, I agree with you that the genetics factor is a factor playing role in this. Definitely, 100% I agree with this. What I want to people not to get our message wrongly, that if you have that genetic factors, so it will happen to you, that I think a message will discourage people from doing the right things. Because of these two scientific facts, I'm not telling this out of my opinion. The two scientific facts, first, the contribution in these chronic diseases, according to studies, of the genetic factors comparing to environmental factors, which is diet and exercise, etc., sleep, and maybe exposure to whatever air pollutions. At best, it will be 40% for genetic. In some studies, it says only 30 to 20%. And environmental factors is actually more, 60 up to 70 or 80% is environmental factor. This is documented in the literature. And there is another saying also, I can consider it as a scientific metaphor. They say genetic factors is loading the gun. Environmental factor is triggering it. So the question is obvious for anybody of you. If you have a loading gun in front of you or in your cabinets, would that bullet hit you if it is loaded gun? It will never hit you until that trigger is happened. So actually, we have a lot to do about this prevention, even if you have that genetic factors, because of course, you are different than other as a loaded gun, but then you have more chance, or you're supposed to do more effort to prevent that triggering factor to happen to you by improving your diet, sleep, and exercise. Because actually, if you are a smart investor, and I tell you, if you are putting your money in this and give you a return of 30%, and if you give that money in this stock market and it will give you 60%, where you're going to pay your money for the rewarding 60%, which is environmental factor. So I agree with you. You might be, as your lifelong, have a higher risk if you have that genetics, but that doesn't mean to cylinder. It's mean you have more, supposed to be more keen to do more about your environmental factor, because here is the killer and the trigger. So this is like another comment.
Good point, Dr. Abdelhadi. We always learn from you. Thank you so much.
You are actually the one we learn a lot this night. Okay, here, finally, can you please inform what early detection can add to the healthy lifestyle? Mention that is exercise, diet, avoid smoking, and not abusing drug, etc. Is there anything else it will add to the factors that you mentioned? A part of exercise, diet, avoid smoking, and abusing drug. Do you want to add any more factors according to this question? Actually, there is a lot of interaction. We are so glad that people, they are enjoying this.
Alhamdulillah. One thing maybe it's coming to my mind, if it's can help or can help for prevention disease, other than what we said in the lecture. I think educate yourself. I think education is more important. When you have learned about the education, about the diseases, you will understand the risk factor of the disease. You will understand the definition of the disease. You will understand how to manage this disease. So I think this is what coming to my mind is educate yourself. It will help you a lot.
Thank you. This is a question from Liba Arif. If your body give you warning sign for most problem, why do chronic disease stay hidden until they become dangerous?
Wow. That's a good question. Anyway, it should be one of MD here. He can help for answering it. But anyway, what she said in the first, sorry.
They said if our body usually give us warning,
warning
signs about the problem. Why chronic disease is still hidden? There is no sign, according to the question. So we start to see when it become dangerous. This is the question.
Yes. One of the pathogenesis of some diseases like hypertension, you will not feel any signs. When it's become more severe, you will feel dizziness. You will feel maybe uncontrolled, unconscious sometime, and this is one of the pathogenesis of the diseases, which is doesn't have signs, doesn't have symptoms until it reach to the severe stage. One of the disease also non-alcoholic fatty liver disease. Some people slim, skinny, and they don't feel the fatty liver in their liver until it's reached to cirrhosis, which is cannot reverse this stage. This is one condition. And the second thing, I think, second point, what I wanted to add for this question, when the I forget this question. I forget this point. Anyway, when the some of pathogenesis is not the pathogenesis of the disease, this normally happen. But the second point, it's flow from my mind anyway. So the pathogenesis of the disease doesn't show any symptoms, any signs, which is when the patient, when the disease is become severe, you will detect that. You will feel some symptoms, some signs to then give you alarm about or warning, as the question said, about the chronic disease.
Okay, I might add in this, if you allow me, Dr. Ali.
Yes, go ahead.
Yeah, well, يعني الحمد لله وبفضل الله Allah Azza wa Jal, He gave us a very, very smart system in our body. Your body is actually really very smart. And I actually love this question about warning sign your body is giving you. That smart system, usually when you have a very sudden, dangerous disease or pathology, that alarming things, usually it's noticeable. Because if you like, it is like a dose effect ratio to the alarm. So if the dose is really high, you have that aurora or warning or whatever. When the disease is creepy and the signals for that disease is very silent, the signals for the warning, it will be the same. It will be very creepy and very low in volume, if you like. And as Dr. Ali said, educate yourself about more education is really necessary for individual and also for the public by giving talks like this one. Because to be honest with this type of diseases, we're supposed to think more toward health than disease. And it's completely two different scenarios. Even for cutoff, for example, say, for example, when we talk about diabetes in fasting, we are looking for a cutoff of 100 to define abnormal glucose level in fasting sample. That is already in the area of disease. So if we are defining disease and talking about it, is different than defining health and talking about it. So to me, if somebody is 35, for example, it's not reassuring. If you are looking for a 35 years young, if you like, person having a fasting glucose of 98 or 97 is just because it's below the cutoff of 100. If I'm looking for health, I would love to see him below 90 if it's not in 80s. So it's all about what is the definition of the warning sign. If the warning sign is needing an admission and running to the ER, that is a really late sign for that creepy disease. But if you are, like, for example, notice yourself that you start to have low activity, so you might think about go and check up yourself. If you, for example, not necessarily going for frequent urination or whatever, just monitor your weight, for example, because you are creeping toward obesity, which is insulin resistance, which is the root of the problem. So if I'm considering that a warning giving sign that I'm going to the chronic disease by having higher obesity, which is related to the insulin resistance, then this is the right warning sign. If I want and wait until the frequent urinations, polyphagia, which is already with the diabetes, then this is a very late sign. And so that it's come all of a sudden. But if you are monitoring your weight, if you are monitoring the right markers, going and ask for home IR, even if your medical provider not advocate for that and you have family issue or family history, then you will detect it earlier and it will not be discovered until it's become dangerous. I think the redefinition of what is the sign and the education, as Dr. Ali, is really going to be helpful. I actually have plenty of questions. But let's say in any role of AI in early detection of chronic diseases, and if anyone provide or it is approved AI tool to detect chronic diseases. Okay.
Yes. Actually, it's good questions because we moved now to the AI and intelligence factory about the chronic disease, and lucky yesterday I was in a conference in King Fahd Hospital in Al Baha, and the conference is about diabetes, and I saw that sensor from Roche company, which is they have the sensor, they put it in their arm, and in 3 months or before that sensor can give an alarm to the patient. He will reach to hypoglycemia or hyperglycemia rate. So I think the future for the chronic disease and for detection, I think it's more effective now with AI tools. And that's good to look for approach about AI or artificial intelligence in chronic disease. Yes.
I totally agree. Nowadays, and alhamdulillah, أيضاً وبفضله, all these smart watches, which is like monitoring a lot of different things happening in your body, and link this data with the presence of AI, with your medical records, and analyzing all this data, all these things, it will lead to, inshallah, improvement. Maybe we don't want to make it too long. The last question is, can you provide encouraging reason, ones that align with human psychology, that make a person avoid eating fast food like Pepsi and fried chicken and eat lettuce instead of that, or something to go for more exercise? I think the question about the psychology, what do you think? Is there anything can help in this regard?
Regarding to psychological stuff in patient with chronic disease, or when there is, I think mental disease or psychological factors is, from my opinion, it's really linked to a lot of things. And as I am not related to a psychologist or psychologist, maybe I cannot answer this question, but it is good to know what is the relationship of psychologist or psychology to chronic disease, and what is the risk factor can affect people to have psychology. We know about diabetes is related to diet, physical inactivity, and this stuff. Obesity, the same thing. Hypertension is the same thing. But psychology, there is, in my opinion, or for me, I'm not knowledge about the link or the relation between psychology and other factors. So maybe if you have any comments, Dr. Abdelhadi, maybe you can add to this.
Yeah, thank you for referring this question. It's actually also proved in studies and data prove that there is food addiction. There is a lot of evidence showing this, especially for sugar addiction. There is some people, they get a little bit annoyed when they hear that it's addiction. They don't like it because it's a bad label. But addiction is actually a scientific term. There is a definition for this, like you are doing things against your wellness and you can't prevent it. So there is a lot of data showing even pathways and changes in the neurotransmitter in the brain related to the consumptions of carb and sugars. And I'm a low carb person, as you know. Related is similar to the pathway that happened with the addicts using some addictive materials such as heroin or morphine or whatsoever. So I totally agree that if you want to tackle such a problem, we just consider it as a very superficial thing, such as habits, and we just deal with these guys by giving them advice to just like give us our excuse that we did education by refer them to the dietitian. Dietitian will give them a very old printed paper of some calorie calculations for them to lose weight without tackling it as a real addiction. In my opinion, it's similar. These guys who's coming with hyperglycemia, for example, or whatever issue related to the chronic disease and their diet addiction. And we just correct that with some medications such as insulin to bring the glucose down. And we give them that piece of paper and we hope that they will solve their problem. It's similar to if somebody come to the ER, he's a heroin addict, coming with abscess, which is similar to hyperglycemia panic results. So we give him insulin. This with abscess, we just clean that abscess. We know that he is addict. And we told him, go see somebody. He will give you a paper wishing you that you will stay away from heroin. And we think this addict person will go out and he will stop heroin and everything is rosy and nice. It will not work this way. If we don't consider this such as an addiction and we deal with it in a way helping that client or patient to overcome that addiction in a stepwise, understanding the physiology, understanding the hormonal response, understanding what steps he has to get rid of his addiction, we will never success. And it is actually can be changed. Just a quick comment. How many person you know, when you talk about all these sugary stuff, for example, Coca or whatever you are mentioning in the question, Pepsi, you are mentioning, how many person you know that he was telling you that I was used to drink my tea with a lot of sugar, but you know what, after a while, I tried to drink that tea without sugar, and I'm happy now. I'm actually enjoying it. So what you think that you are so attached to it, you just need sometimes and the real help with the scientific people who understand that link of addiction to get rid of your attachment of these foods. So the psychological part of this is actually, I agree totally, is very big player. I just will conclude with a very short story to prove that it's addiction. I have a patient, unfortunately, he was early 20s. He was type 2 and already using insulin. And I was telling him how you rate your attachment to the sugar in my evaluation to assess that psychological things out of 10. He said, doctor, if there is any score more than 10, I will score it more than 10. Then I said, oh, why? He said, when I was driving, sometimes I crave sugar. While I'm driving, I stop my car, go and get some sweets, ice cream or whatever, and he's diabetic. I eat that sugary things, I inject myself with insulin, then I continue my trip. If that is not addiction, what is the definition of addiction? I wonder. And if you see your relative amputated their legs or whatever, and you continue eating these things, and you are seeing that thing, you're still insisting that I'm attached to this. If this is addiction, what is addiction? So I totally agree. The psychological part is very important. It's a very complicated, as you show, Dr. Ali, in your presentation, a lot of factors there. We have serious problem. So we're supposed to have a serious effort, such as these webinars, these educations. I don't want to make it long. I actually would like to put together for Dr. Ali for this excellent presentation. Thank you. To thank everybody for your attendance and staying with us for almost 2 hours. And many thanks, and wish we will meet you, inshallah, in another webinars. For the CMEs, maybe you can contact the SSC, because there's a lot of questions about this Shahada and CME. So SSC, inshallah, will contact you in this regard. Any comment, Dr. Ali?
Thank you so much, Dr. Abdul Hadi. And actually, we need more from like this meeting, this lecture, these seminars, which is really we share knowledge between each others, and I am so happy when I saw this more than 200 people, they attend this lecture, and I saw a lot of interaction and questions, and a lot of even a lot of comments from our audience, and this is make me really happy about what we have done in this lecture. And we thanks Saudi Society for Clinical Chemistry for giving this opportunity for us to contact you and talk to you about some of the serious issue about chronic disease. Thank you, Dr. Abdul Hadi Bima. Thank you so much for your comments. Thank you so much for your knowledge and sharing with us this knowledge. And without you, we will not get this to this point with a lot of interaction, a lot of people asking because of your information and your nice talk and story. Thank you so much for all the audience for us today, and have a good night, and thank you a lot for your attending, and assalamu alaikum wa rahmatullahi wa barakatuh.
Yeah, thank you. We'll leave it here and have a good night. Alaikum assalam wa rahmatullah. Bye bye now.